Very well. Good afternoon. I am David Gomez coming to you live from London on what is a really nice day outside, it seems. For once, we have quite a bit of sunshine, and I'm hoping we can enjoy that for the rest of the week. This is the Ramphal Institute. In this, the second remote roundtable on managing air quality in Commonwealth countries, looking specifically at municipal transport policies for COVID-19 recovery. Welcome to all of you in the Commonwealth and around the world, and a special welcome to our esteemed panelists joining us today, Professor Jagan Shah, who is the Senior Infrastructure Advisor at DFID in Delhi, India, and previously Director of the National Institute of Urban Affairs in Delhi, and an urban development thought leader with over 2 decades in influencing urban plan policy and action. Mr. Elliot Treharne, who is Head of Air Quality at Greater London Authority, previously Clean Air Advisor to the Mayor of Los Angeles, and also previously Air Quality Manager with Transport for London. And Mr. Gbenga Dairo, Commissioner for Transportation in Ogun State, Nigeria, an engineer with extensive experience in transportation planning and management, a member of the UK's Chartered Institute of Logistics and Transport, and also a previous advisor to transport offices and department here in London. So welcome. I'd like to also thank Ms. Noemi Ventia, our very capable research intern for air pollution and environment at Ramphal Institute, without whose stellar work, none of this would have been possible, absolutely none. And of course, Richard Bourne, Ramphal Institute's founder and now advisor for his tireless pursuit of this agenda. Welcome to everyone. First, here's my brief take. One of the silver linings of the ongoing COVID-19 global pandemic has really been the unanticipated reduction on air pollution stemming from the lockdown of cities and communities across the world. As that progressed, I think satellite images started showing dramatic declines in greenhouse gas emissions resulting from significantly less cars on roads, decline in industrial production, and the halting of human burning of fossil fuels. As people from Delhi, London to Lagos marvel at blue skies and cleaner air overhead, it was also becoming evident that the pandemic provided a unique opportunity for redressing the impact of air pollution on underlying health issues and respiratory illnesses, and which make people more susceptible to the coronavirus. Yet the nature of the virus itself, which spreads primarily through contact with infected persons, through respiratory droplets from coughing, sneezing, that can be inhaled or picked up from hard surfaces, soft surfaces, has made public transportation systems very high-risk environments due to the high number of users, the multiple means of transmission, money exchange, ticket machines, handrails, seats, door handles, etc. In this new context, municipal transportation authorities across the Commonwealth are faced with new challenges related to how to adjust their transportation systems to extend the unintended benefit of clean air while preventing the spread of the coronavirus. At the same time, there is now widespread and growing acceptance that better municipal transportation policies can help to reduce the adverse health effects. But this requires implementing policies which change deeply ingrained behaviors and cultural practices, and also requires new forms of government action, including consideration of fiscal incentives and measures. That is the topic of today's remote roundtable. What has been the response of municipal transport systems across Commonwealth countries in the wake of COVID-19 pandemic? What new policies and initiatives have come out of the pandemic, and how can other Commonwealth countries, cities and countries, including the small island developing countries, learn from the experiences in Delhi, London, and Ogun State? As it relates to municipal transport systems, the bigger question here for us to consider is what lessons of improving air quality can be learned from municipal transportation authorities' responses to the COVID-19 pandemic? What happens next? The matter of air pollution has been an area of consideration for the Ramphal Institute, and in 2018, the Institute convened the first annual conference on air pollution in megacities here in London. That forum found that air pollution harms all ages, that it is a silent killer, and that it affects not only physical, but also mental health. And get this, it is linked to poverty and to inequality. The 2018 forum put forward a number of recommendations, including the need for greater political urgency by framing poor air quality as a public health concern and espousing a rights-based approach to clean air. And by also exposing the nexus of inequality and air pollution, that makes this an issue of social justice. Earlier this year, the Ramphal Institute launched a webinar series on air pollution. That was done in conjunction with our partners, the Federation of Indian Chambers of Commerce and Industry in Delhi. That first remote roundtable focused on policy lessons from the impact of the COVID lockdown on air quality in Commonwealth countries, and other events are planned, one other roundtable perhaps before the end of this year, and then an international symposium in the first quarter of 2021. The remote roundtable today is a part of a wider set of initiatives by a revisioned Ramphal Institute. The Institute has refreshed its approach of engendering discourse and interchange around current and emerging challenges to the Commonwealth while retaining its founding DNA and its focus on the areas of social and economic policy, governance, and environment. We invite you to join us or support us on this new journey as we illuminate the Commonwealth and bring fresh insights into its continuing place in a rapidly changing world. But first, let me give each of our panelists a chance to say a few words on what they've been doing in their respective municipalities. And I would like to start them with Professor Jagan Shah from India. Professor?
Thank you, David. And my apologies for this really terribly skewed visual. I had to join through my phone instrument rather than my laptop. Well, David, you've described a very broad and very critical scope for the question about the quality of life and the quality of life linked to environmental factors like air quality and such like. The air quality factor is very important for Indian cities, and I'll speak for a number of municipalities, if I may, because DFID in India has been working on national level urban programs with the Smart Cities Mission of India, for instance. I'd like to look at it more in a kind of a systemic way. And what we found is that COVID has, for instance, been devastating in terms of its impact on public transport. I mean, just public transport systems simply don't have the kind of resilience built into their very design and their financial modeling and everything that can account for this kind of an impact, where, for instance, space standards change suddenly because of social distancing. The number of passengers that can actually sit in a bus or in a metro car suddenly reduces dramatically, and all returns on investment on any of these systems, while they are fanciful at best, will still rest on the number of people who actually occupy these systems. So it's been devastating in that sense in the Indian context. But on the other hand, there are some very important impacts which everybody is feeling with regard to city planning and city governance. The impact, sort of the combined impact of social distancing, the work from home potentials, and the rationalization of travel itself in terms of people choosing to make shorter trips or not making trips at all, and such like, and modes have changed. So, this is a moving target at the moment. But I think we can anticipate that in the Indian municipal context, municipalities are going to have to completely recalibrate their response with regard to transportation and public goods of that kind. There is a heightened realization of the need to localize public systems more. The public health systems failing during the COVID crisis, for instance, and having to be given an enormous boost of life, so to speak, is not a good sign, because municipalities are supposed to actually take care of public health within their ambits in India. But they simply didn't have the capacity to deal with any of this. So there's a number of different points on which we are realizing that if in the Indian context, one can be, and forgive me for using this much maligned word smart, but if one can be smart about one's planning and governance, then one can use the combined impacts of, for instance, pedestrianization, which is a very important tenet within the National Urban Transport Policy of India. A story that we have seen is something that DFID was associated with, which is to create this network of integrated command and control centers in all these 100 smart cities. And what what is the kind of data that can be monitored centrally in a control room within the city, following on more global best practices in terms of city management. That has been a huge success because it has helped in dealing with COVID. All these cities that had these control rooms suddenly became the war rooms dealing with the COVID situation in terms of contact tracing and various other needs. So that's been an interesting learning, that there is a kind of a use for data-driven, evidence-driven decision making, and there is an acceptance within the governance ecosystem. And I would mention lastly that a very important opening has been created in some sense through the recognition amongst elected representatives, politicians, what we refer to as politicians otherwise, the recognition that there is a strong link between public health and public health indicators, such as, we've just had a news report, I think it was yesterday, that's been devastating. People have realized that projections are that urbanites in India may be losing from 6 years to 17 years of their life because of air quality problems. So this consciousness now that the environment of the city itself is hazardous to health to an extent that it requires policy response. This is a good moment. And I think in that context, I congratulate the Ramphal Institute for having taken up this sort of bold move to put the issue of air quality as being central to a city's response to the future and its delivery of public goods. I'll stop there, David. Thanks.
Professor Shah, thank you very much for that. I will come back to you definitely on that link between public health and air quality, and certainly between the built-in resistance in transportation systems. Let me turn now to Gbenga Dairo from Ogun State, Nigeria, to share a bit of their own experiences there. That's Gbenga.
Right, thanks very much, David. And I hope you can hear me. And I'd like to thank the Ramphal Institute for inviting me to take part in this round table. First, if I may, I need to introduce Ogun State, where I am from. Ogun State, I'm at the capital city called Abeokuta, which is about 80 kilometers or so from Lagos. It is one of the 4 big cities, I would say, within Ogun State, where we have a population of about 200,000 to 500,000 in these cities in Ogun State. Ogun State is such a large area. It's about 160 kilometers from east to west and about 80K from north to south. So we have a large rural population. So I think we might all agree that air quality concerns are likely to be most prevalent in the urban areas, such as the city of Abeokuta, where I'm at. As it happens, the Future Cities program is concentrating on Abeokuta as one of the programs they're having, or they're working on in Nigeria, alongside with Lagos, funded by DFID and UKFCO. So I think what we've observed in our city here, capital city, is that the lockdown has clearly revealed to one and all that traffic is a major contributor to high pollution levels. In our part of the world, we also suffer from power difficulties, so the large numbers of generating sets equally contribute to pollution in our towns and our cities. But I think the observations is that the lockdown situations we all had to go through in the last few weeks, especially when there were no movements around, actually we could observe that the quality of air was vastly improved from that point of view. But having said that, I think I need to warn all our listeners that in our part of the world for now, the priority concerns of the citizens of this part of the world, if I may say so, are still to do with safety and affordability of public transport. And that is one of the reasons why the ministry that I head has just been established. In fact, I'm the pioneer commissioner here. It was established only about 3 or 4 months ago. My own thinking is that by the time we begin to address safety and affordability, simultaneously we begin to look at the pollution issues, air quality concerns that most of our commuters and travelers will also encounter during their various journeys. So in terms of initiatives here, the vast proportion, if you look at the public transport mix in Ogun State, we find that we observe that motorcycle taxis are quite common. They probably constitute more than 50% of the numbers of vehicles we have on our roads. And I think we all will agree that they are one of the major contributors to pollution, especially given that most of the vehicles used for this particular purpose are the two-stroke engine types, which are cheaper, obviously, to purchase, and therefore reflect on the affordability issue, which is why people tend to go for that. And they contribute significantly, I think, to the air quality degradation. So on our side now, we're beginning to look at ways in which we can begin to regulate them better, to ensure that even if we are to rely on motorcycle taxis for a lot of our journeys, we want to make sure that the vehicles that really comply with certain standards. And clearly the degree to which they cause pollution is one of the standards we shall be looking at. We're looking at also ensuring that those who have to use this mode of transport, or who operate this mode of transport, understand how to use them, especially in the public space. In an urban area such as this, because their behavior, the way they ride those vehicles equally has an impact on the degree to which they affect safety, and equally the amount of pollution that those vehicles actually emit. So we're looking very hard at regulating that particular sector. And as I said, even though our primary concern continues to be safety and ensuring that the public modes of transport are affordable, a byproduct of that focus, I think, is reduction in air pollution levels. And as we speak, we're embarking on the transport master plan planning process. The idea, importantly for us, is to match demand for travel with the supply of modes of transport, because we find that in our part of the world, there's an oversupply, or especially of these motorcycle taxis. And so there's so many taxis chasing around so few passengers, equally adding more to pollution than they ought to be. So by the time we're done with the planning process, we should be in a position to match supply to demand. We should be in a position to introduce other forms of transportation that may reduce our reliance on motorcycle taxis, and also promote other modes of travel, such as walking, cycling, and so on. So I think I'll stop there for now, and then, when we get around to further discussion, we can elaborate on some of these points. Thanks, David.
Yeah, Gbenga, thank you very much. And I'm glad you shared that. Before I turn to Elliot, Treharne, I think it's going to be interesting to come back to you to hear what you guys are putting in place to address what I believe are deeply embedded now social and cultural practices. The motorcycle taxis, transportation is as much a part of the everyday living in your part of the world in Nigeria as it is a tourist attraction for people coming to see that this actually happens and things. So, Elliot, let me turn now to Elliot. Treharne, Elliot, if you can unmute and add your video as well, that would be good.
Hi, so everyone should be able to see me. Is
Excellent,
it
there you are.
to share my screen? It's currently disabled, but I've got some slides, which would be just a few.
Yes, let me,
Would be quite interesting, hopefully, for people.
yes, so how do I do that with you? I'd have to hand this to you, right?
Hopefully. Oh, let's see. Host has disabled participant screen sharing. It's not the end of the world if we can't.
Okay, great.
Okay. So what I would just basically wanted to, just a few reflections from me, is that to start off with, in London, air pollution's been a major issue for, you know, generations, and someone has done the equivalent of my job since the 13th century. So this has been quite a deeply ingrained issue. And when you think about air pollution in London, the biggest single source is from road transport. So what's been really interesting about what's been going on in relation to COVID-19 is actually about how you might see additional changes in terms of transport behaviour, how that can be a good thing, more walking and cycling, or a bad thing if you end up with a car-led recovery of people not wanting to use public transport or not able to use public transport due to social distancing. So in London, we were quite lucky in terms of when COVID-19 hit, in the sense that we'd already done a lot of work in terms of developing integrated strategies, which put at their core mode shift and the promotion of active travel with much more walking and cycling, which meant that we were able to respond in real time quite effectively to some of the challenges through a massive program called Street Space, which I'll talk about in a while. But I think perhaps the key thing to bear in mind is that we'd already been taking significant action to improve air quality for a long time ahead of when the COVID-19 lockdown actually took place. And one of the kind of signature interventions that we had delivered in London was the Central London ULEZ, the ultra low emission zone, which requires people who drive in the centre of the city to pay a daily charge of £12.50 if they're a car or a van, or £100 a day if they're a heavy vehicle like a bus, coach or lorry. That was introduced on the 8th of April 2019 in the centre. The plan is to expand that out until it covers up to the north-south circular, and across the whole of London we're also going to introduce tighter standards for heavy vehicles because heavy diesel vehicles can also have a particularly big impact on air pollution. So the Central London ULEZ had already had a massive impact. We estimate that before lockdown it had already helped to reduce pollution in that central zone, nitrogen dioxide levels, by about 44%. So that was a very significant change. We'd also been taking complementary measures in terms of our bus fleet to make sure that all the buses in London will meet the Euro 6 standard by October of this year. And also we're trying to accelerate the phase out of diesel taxes. And from 2018, no new diesel taxis have been able to be licensed. Instead, we've had to switch to a zero emission capable taxi. And we now have 3,500 of those on our streets. So we'd set the scene already with quite an ambitious package of action, which had already improved air quality before COVID-19 hit. But when it did hit, we saw some very significant changes in traffic. Traffic was reduced by about 50%. And this, as you would expect, resulted in roadside pollution levels to come down. We estimate that in central London, NO2 levels came down by about 40% on top of the 44% we'd already seen, and across the whole of London down by about 20%. And I think that really speaks to the fact that, and I think a key point to take away is that there had already been significant progress in terms of tackling air pollution before COVID-19. Obviously, though, it's very important, as you know, COVID-19 is a vicious respiratory disease, that we continue to take action to improve air quality, that we try and protect Londoners, especially Londoners who are trying to recover from the illness. And we also recognise the contribution COVID-19 makes in terms of pre-existing conditions, things like COPD, which we also know worsen clinical outcomes. But in terms of the response to COVID, one of the key things that we actually saw was people being less able to use public transport due to social distancing. The tube network was down to about 15 to 20% of its usual capacity, the bus network down to about 20 or 25% of its usual capacity. So we were really keen to introduce a program called Street Space, and what that enabled us to do is to provide more space on the street for walking and cycling, also for commercial activities, so outside bars and pubs and restaurants, so that they could have space to actually accommodate more guests outside, And in central London, we actually created one of the world's largest car-free zones in the capital city, which we're particularly excited about, with a number of bridges where we are putting in place restrictions to vehicles. And by doing that, to enable forward kind of travel from when people arrive in some of the terminal train stations to be done by bike or foot. And also to complement this, it was very important that we didn't just see, instead of people walking, cycling, people choosing just to jump in their car instead. And so that's why temporary changes to the congestion charge have been introduced, which again is in the centre of the city and includes increasing the hours from 7 a.m. to 6 p.m. to 7 a.m. to 10 p.m, including weekends for the first time, and increasing the charge level from £11.50 to £15. And the challenge now is, as we start exiting, or at least from the first wave, and hopefully there won't be a second wave, but potentially there could be, but as we start exiting the lockdown and there is a gradual return to the new normal, I think we have seen these improvements in air quality. People have appreciated them. They have liked having the clearer skies, the cleaner air, the reduced impacts on them personally and on family members. And I think really the challenge as we go into the recovery is actually, how do we lock in the positives of COVID-19? How do we lock in the improvements that we saw in air quality? And how then do we kind of increase our ambition and actually use this as a moment where we can actually start working towards a zero pollution future, where we actually address man-made or human-made air pollution once and for all. Thank you very much.
Thank you very much for that. I think the experience in London certainly has illustrated the need for that resilience that Professor Shah made allusion to, or alluded to in his opening comments. If I can come back to you immediately, Elliot, the low emission zone initiative in London was a bold one, and it got, I think, recognition around the world for that. But we've also seen, as a result of the lockdowns, where new bike lanes have been put in. And how difficult was that for you to, or how easy did it become then for you to put in place those initiatives? Because I think prior to the lockdown, perhaps you would have had more hurdles to jump over. And what can other Commonwealth cities and countries learn from that experience?
So a couple of reflections. I think the changes that have been made due to COVID-19 have been emergency changes. They're temporary changes, but I think you can learn a huge amount from those changes. And I think people, once they actually see a change, that can actually buy or secure buy-in to actually making wider, longer term changes. Of course, going through the proper processes to do that. But I think the kind of key learning has been the need for speed. I think it's one of the, although there have been challenges, I think the entire kind of government system in London, with support from national government, but also leadership from the mayor, and then using existing channels to distribute the funding to enable our local authorities, our boroughs, to actually implement some of these changes on the ground, has worked quite effectively. But as always with these things, you don't necessarily get everything right first time, and there is a certain element of iteration in the delivery of these to respond to local concerns as they arise, and to adapt and adjust. And of course, that process is ongoing. But I think the key thing is that there's a high degree of public acceptability, because people know that the COVID-19 pandemic requires a kind of a strong and kind of a clear response to address some of these challenges to enable us to continue to be able to socially distance.
Yeah. Professor Shah, if I can come back to you. In the conference in 2018 in London, you had made mention of something that was very interesting. You said that there was not enough of a correlation between planning and public health outcomes. And you had also identified weak local governments as being a stumbling block to progress on addressing issues of air pollution. Do you feel that is a part of the challenge in building that resistance and that resilience in places like India and Delhi and other Commonwealth countries?
Thanks for that question, David. Very, that's a very significant aspect of the challenge before us. I think in the Indian context, there are chronically weak municipalities, and now it's a sort of a globally known story, so to speak. We don't have empowered mayors. We've got too many different departments and so on. So without that unified leadership, it's not able to take the kind of decisions that a city like London might be able to take, for instance. Although, of course, the challenge is there in coordination. But I think, Elliot mentioned need for speed, and I think that's the key thing. That's the sort of the indicator of success if we have to look at municipalities and municipal functions. How soon can they build the resilience? You can't take 2 decades to build resilience. You can't say we'll build resilience by 2030 because the SDGs give us that kind of deadline. You got to build quickly. You got to adapt quickly. So adaptation is a very key aspect of this, in terms of policy, in terms of regulations, in terms of Gbenga also talked about regulating the motorcycle taxis, for instance. Now these are challenges for weak municipalities. They don't have the ability to regulate. And if you do not have the ability to regulate, then you do not have the ability, therefore, to enforce standards. And so it just becomes sort of like a never-ending kind of problem. It's an intractable kind of situation. I think in that context, the Commonwealth has a very important potential role. That network of countries that look at standardization across their economies. That is important because one of the key ingredients in the building back better story, the green recovery of our cities after COVID, is going to be ecosystem services. We simply don't have the capacities in municipalities to actually respond. How do you solve these problems if you don't have the professionals and so on? So some innovation will be required to build the innovation ecosystems that cities require in order to speedily and in an agile way respond to the mounting hazard with regard to the environmental externalities of urban development. So in some fundamental sense, what you started your question with, my reference then, is also to do with making sure that that the lessons from COVID are not lost. So that's an institutional imperative, I think, for all of us to ensure that we transmit those messages into policy making as we go forward. And I think there are 3 key aspects here which get linked up. I had mentioned what you mentioned about 2018. I talked about public health and urban planning not being thought of together, but actually now COVID has revealed a much bigger systemic sort of failure, you might say, in terms of being able to respond. So it's not just about urban planning and public health not being aligned or connected, but it's also about public behavior, for instance. In the Indian context, that has been an enormous challenge. Or for that matter, the seeming ignorance of policymakers to the complexity of an informal economy, for instance. So, we had this enormous migration of informal workers out of our cities back to villages, and perhaps now as they return to cities, they're either carrying asymptomatically, they're carrying the disease, or they might encounter it now when they come back to the cities. So there's been a peculiar kind of blindness as well, and I think in order to get rid of that, we need to work at a systemic level when we talk about cities and cities responding to a very core issue like air quality. It will require the harnessing of public discourse at a level that, for instance, the London mayor was very successful in doing, and we watched with awe and amazement at how it seemed how effectively this initiative of no idling outside schools and such like, those kinds of zoning rules, how effective they were. So I think, just to close on that, again, I just want to flag and I want to strengthen exactly what Elliot said about need for speed. And we must measure our responses with regard to how we can do this quickly, because we don't have time on our side. And I think I mentioned earlier about the middle class in India will certainly wake up to this, realization of mortality being closer than they expected. So, it's all going to have an impact, but we need to build around it. Thanks.
Yeah, thank you very much. Gbenga, if I can come back to you. I think a couple of the points that have been raised by Elliot and Professor Shah speak to the type of systems, public policy making systems that lend to more resilience in responding to issues like COVID. In Nigeria, they like speed, but they like a different kind of speed. And that's why everybody is on the back of a two-stroke motorcycle trying to get ahead of the next competitor to pick up the next passenger. I was shocked when I read that your daily demand for passenger trips is around 12 to 15 million in Lagos and the Ogun State area combined alone. I'm not even talking about any of the other cities. That is a significant, out of that, 95% are undertaken by road, primarily by private cars, buses. How do you overcome the challenges of responding to what COVID has presented in terms of addressing public needs, health issues, but also ensuring that the ability to meet transportation demands are there? What things have you been putting in place to try to address that?
Well, thanks very much. I just want to re-emphasize one of the things that Professor Shah said, and one of that is the issue of capacity. So even within the public sector space where I am at, galvanize ourselves so we're able to respond to some of the questions you're asking. It's a task on its own. As I said earlier, we're a new ministry, we're more or less a startup, and we're just about building ourselves up, at least in this part of Nigeria, to be able to begin to address the changes imposed on transportation, all forms of transportation. But I think, as I said in my opening statement, the priority here, certainly for the political leaders and everybody else concerned, still revolves around safety and affordability of transport. And so for those of us who are equally concerned about air quality, is to see how we can piggyback on addressing those two issues and see how, to the extent to which we can also reduce pollution levels by the time we've created a safer environment for people to move around and more affordable transport. So in my own mind, in the part of Ogun State where I am, if we're able to reduce the numbers of motorcycle taxis, as an example, I think that would be a significant intervention in terms of pollution levels on our streets. If we're able to reduce the numbers of motorcycle taxis that are chasing the fewer numbers of passengers that are around, again, that will have a positive impact on pollution levels in our environment. But the critical challenge for us all here is for the public sector post-COVID, where internal generated revenue has gone down. Nigeria is a very oil-dependent country, and therefore our income has gone down as well. So the proportion of investment in the transport sector itself, unfortunately, is also going down. So once we could see the positive benefits of COVID in terms of reduced activity during the lockdown situation, but it has a severe economic impact in our part of the world, which is obviously restricting the level of investment that we can now devote to all sectors of life and economy in our area, but also significantly also in the transport space. But in the long run, the best way in which we can address this matter, in my own opinion, is for us to begin to reduce the reliance on motorcycle taxis, and even where we have to use them, they are better, of higher standards, better quality, and that way I think we may have a positive impact on pollution levels in our part of the world.
Thank you, Gbenga. Elliot, if I can come back to you, a couple of points have been raised about capacity and investments. I know that London has been ahead of the curve in terms of making the right types of investments. You had put in place an initiative to have the entire bus fleet changed out to electric buses by 2025, if I'm correct, or earlier. We've seen a similar initiative in Barbados, where recently they have begun to transition their bus systems over to electric buses as well. how much of a factor would future investments be? The ability to make those investments in transitioning the infrastructure for that, as well as the equipment needed for it. Because I think perhaps London is in a better position than most of the other municipalities or cities. What can you lend us from the experiences that you've had so far? And what do you think some of the challenges with making that, realizing that full transition is going to be?
So they're great questions. So I think the first thing, just a clarification point. So the plan is for the bus fleet, which is 9,100 buses, including about 6,000 double-deck buses, to be fully electric by 2037. But we actually want to bring that date significantly forward. But in order to do that, we need, additional support and funding from government. So there is a real opportunity with that in the context of a green recovery. This creates jobs that helps us secure investment in sustainable green jobs, which I think are really important. And I think that it also links into the fact that we need to encourage people to get back onto public transport, because there will always be the need, if we're going to achieve our overall targets in terms of tackling air pollution or climate change, to actually have more people using public transport, walking or cycling. So that's an absolutely critical part of the mix. As I say, the key issue, the key barrier that we are going to face, I think, is probably ensuring that we have sufficient support from the government, and that investment is made, and and through that we can deliver not just the fully electric bus fleet, but also wider benefits to the economy and to the UK, and also hopefully accelerate in a positive way by working with other cities the availability of this technology, its range, its cost in terms of capital costs. And by doing that, we will hopefully have a virtuous race to the top between cities, but where any city's investment or progress in terms of electrification of its bus fleets will actually make it easier for any other city to do so, because there will be a clear message to manufacturers that this is the future, this is where you should be investing, these are the products that are needed, and they need to be at a certain cost point. So I think that kind of gives a quick summary of the barriers, but I think the key message I'd take away is this is the time to invest in green solutions rather than other alternatives, which might drive a kind of a resurgence in fossil fuel. This is the moment that we have to seize to make sure we have a green recovery.
I completely agree with you, Elliot. Professor Shah, let me come back to you very quickly. You had made a very brief mention of the C40s, or you alluded to it, the C40 Cities Initiative. I think Delhi is a part of that. London is certainly a part of it. The kind of support network that you need for putting in place, making those bold, or taking those bold policy decisions now and putting in place new measures. How supportive, what is the benefit of being a part of that C40s initiative, and how can cities harness whatever is happening from the partners within that to make sure that they go down similar paths that Elliot talked about now, but about getting that shift happening at this juncture, at this moment?
David, I think there's a short answer to that, which is that the hunger or the demand for solutions is so high in a context like India, I mean, which is still got a very large number of people living in poverty, despite the fact that it is said to have a space program as well. I mean, so it is a country of contrast. But my point is that to bring the kind of support together, I think it will require us to kind of unbundle the challenge a little bit, because clearly, if you are part of a network like C40, you are certainly learning, as a city manager. But which is the level at which probably that network is going to work, or you might learn at the level of a senior executive in the city management possibly. But what you need is also a community level participation in this green recovery. And that's crucial, because I think we assume that the state has a sort of an endless ability to scale its effectiveness, obviously that's not true, and e-governance and the use of digitization has helped a lot. Of course, digitalization has helped a lot, but having said that, we must understand that if local communities are not part of this transformation post-COVID, then then we are not going to achieve our objective. It cannot be only state-led. And because it's an act of adaptation largely. So, I think we need to at least look at the neighborhood level and the city level, as two levels, where at the neighborhood levels, communities can adapt quite well, actually. They're very good at that. They're very resilient as it is at their scale, but then focus the city on the requirement for the city level infrastructure. And I think in that regard, public spaces and transportation networks, these are the two high priorities. And we need to build around these very tangible kind of targets that we need to make, public spaces, because, we cannot throw away the city in the act of social distancing, so to speak. We can't throw away what the city has to offer. So in some senses, you're also trying to do a green recovery of the city itself, because people are beginning to question whether urban life itself is worth doing. So I think making sure that our influencing is taking place at the city level as well as at the neighborhood level is really crucial, and making sure that we pay attention to the fact that for communities to sustain the green recovery, they will need skills. And like Elliot also mentioned, there is a need for those ecosystem skills that I also referred to. And that simply currently doesn't exist. I think, capacity has been also flagged by Gbenga. I mean, this is clearly a big issue, but formations like C40 help you to learn a little bit of the story, but you do not actually get enough. And I don't mean to belittle these networks. I mean, they've been enormously helpful. I mean, the 100RC network has been enormously helpful as well, supported by the Rockefeller Foundation. But having said that, at the end of the day, cities and getting cities right is a very, very local affair. And it's a very complex local phenomenon, which we must appreciate. So there's a limit up to which national level policies are able to impact cities, unless the cities want that impact.
Professor Shah, staying with you, I think you've put your finger on something that I think is crucial. I think there is a big difference between extracting compliance and trying to engender innovation and a more holistic way of dealing with the challenges we're now faced with. How is Delhi and India dealing with that matter? Is it a part of Delhi's graded response plan for air pollution? And if not, how can that become a part of that?
So you're referring to specifically what's happening in Delhi? What are the kinds of partnerships that?
Right.
I think there are some key challenges in meeting this overall goal of making our cities have clean air. One, for instance, is simply the networks of data collection that you require in order to actually have a policy response. Delhi is hugely fortunate to have a large number of stations through which it collects data. Most cities in the country have next to none. And the smart cities sort of mission was actually also spurring the adaptation, the adoption of environmental monitoring stations and such like. So there's one aspect here which which is related to getting systems and technology. I think Elliot had to leave.
Yes.
Getting systems and technology in place. The second is getting the institutional, ecosystem in place. Delhi is fortunate; it has a number of technical institutions, universities, the Indian Institute of Technology in Delhi. There's therefore, a lot of knowledge, technical knowledge available in the city, and so the city benefits because of that. Again, this is not a privilege that is afforded to all cities in the country. So, there is that unequal distribution of technical, capacity in that sense. So I think, if this needs to be a graded response, it needs to build ecosystems beyond government departments and beyond what you expect to be the point of greatest response. And I think those ecosystems are what DFID in India, for instance, is working on developing, both in terms of being able to infuse innovation into government decision making, being able to make it affordable and accessible through procurement systems, and so on. So there is a fairly large plan of the Ministry of Housing and Urban Affairs in New Delhi for creating a national urban innovation hub that actually links municipalities across the country, and also links up a larger ecosystem that supports municipalities in these kinds of challenges.
Gbenga, let me come to you. Some of the points that have been raised by Professor Shah and Elliot don't map directly onto the experience in Nigeria. I think you do have cultural differences, societal differences that make it a lot more challenging to implement or to achieve some of the initiatives that they've been have been speaking about. I think you have the added challenge of being so close to Lagos, yet far enough away from Lagos that sometimes you're ascribed a secondary status almost to a bigger city there. How do you operate and make your own initiatives effective, if I can say, in the shadow of a bigger city? How can you bring forward some of the success stories to make sure that what you achieve as the first commissioner in this role, that could be shared with the wider Nigerian state, and then from that out to the wider Commonwealth?
Thanks very much, David. I think you're right in pointing out that we're pretty close to Lagos, and we have significant population of Ogun State residents who more or less live in Ogun State but work in Lagos. So both states are actually working together now to begin to see how we can jointly prepare plans for those conurbations that more or less straddle both states. Because, as I'm sure everybody knows, transport really does not recognize administrative boundaries and political boundaries. People just live in an area. And we've all come to recognition now that ourselves on this end and Lagos must work together. So both governments are putting together something called the Lagos Ogun Commission, which will look at planning, waste management, transport, security, and such like. And we're making some strides on the transport front, just to make sure that we can piggyback on some of the things that Lagos are doing here in Ogun State. Lagos is very advanced in terms of hooking up with development partners, for example, the World Bank and such like. So we're going to see how we can leverage on their connections, so to speak, so that we can begin to draw interest into Ogun State as well. Whether we like it or not, Ogun State is more or less now the industrial hub in Nigeria, because Lagos is very congested. Lots of people are moving into Ogun State where they're setting up shop and so on. But our own determination on our side is to ensure that we learn from the mistakes of Lagos and don't allow Ogun State to grow in that direction. And I think we observed that in Lagos, the growth was very much more private vehicle, road transport based. In Ogun State, now we have a ministry. The idea of public transportation, I think, is gaining ground. People now accept that public transportation is a viable way of moving around. You don't necessarily have to insist on having a car before you go from one point to the other. Not just because they're very expensive and out of reach as well. So here in Ogun, as I think I pointed out earlier, unfortunately for us, we've seen a significant growth in the use of motorcycle taxis, and really we need to stem that growth very quickly and move on to buses. And then from buses, we move to much more environmentally friendly buses, and we're tracking that direction going forward. I was glad to hear or to be reminded about C40s by Professor Shah. So it's something I need to go and plug into to see how it is we can benefit from support from the likes of C40, because not only, we need to ensure that we bring this thing up so that the political leaders here, the elected officials themselves, see it as a key issue, a priority, and there's significant clear linkages between air pollution issues and public health. Especially now that the public health space, or for the health sector in general, in our country and the world, is become extremely important. Now, as a result of COVID, a lot of investment is going in that direction. It's exposed a lot of the areas where primary healthcare has been very poor. Now things has been done in there. And now even our own ministers of health have been to think, look, how can we prevent people having to go into clinics and hospitals in the first place? And then, so an argument can be built around that. And look, if you invest here, it also can help you, help us rather, in reducing the exposure of patients to hospitals and such like. But we're just starting here. We're not as advanced as they are in London, certainly. And I think India is also one or two steps ahead. There's a lot of, this speak about capacity. I think the capacity in India is far much more at a higher level, even in comparison to what's here. So I have a challenge of ensuring that the people here understand that we have a lot of work to do to get people to understand, the transport planning processes, the objectives, how we address them, indicators we need to monitor, and to ensure that we are performing on all these fronts.
Yeah. Ogun, Gbenga, let me come back to you for a final 1 minute of closing comments before I go to Professor Shah. Any final thoughts you want to leave with us here across the Commonwealth about what needs to be done, what can be done?
One other point I haven't mentioned, which I think is important, probably important also in a place like India, is to see how we can reduce this migration from rural areas to urban areas. It's wider than transport, obviously. There's a lot of economic issues around that, how you can ensure that rural populations can actually sustain themselves and reduce the drift into urban areas, which I think is an issue for us, even here in Ogun State and generally across Africa.
Thank you very much. Professor Shah, any parting shots from your end?
I think one key message I should say is that we are now in a decade when the measurement of the performance of cities is high on the global agenda, so to speak, and I think COVID has now given it yet another dimension. But I'm speaking about processes like the Paris conference, COP26, which is coming up next year in Glasgow. These are opportunities where we will be able to also talk now about global systems that help us to measure the challenge with regard to issues such as air quality, for instance, which is now a key indicator, accepted by many countries, and we will have the opportunity to talk about the kinds of issues that, for instance, Gbenga just mentioned, which is how do you do rural development such that you don't have the kind of migration that you have. Although that's an inexorable process. Urbanization is not something which is easy to, one can't reverse it very easily. But having said that, the conversation around COVID has given us an opportunity again to revisit what kind of economic activities can be done in rural areas such that if you're able to provide large transportation grids, people don't hesitate to live in rural areas, do business there, run enterprises, run green businesses and such like, and don't necessarily want to live in these sprawling urban centers, which are inhospitable in terms of their environment and so on, and quality of life. So I think we are in the midst of a kind of what shall I say? It's a churn, and it's a very large global rethinking. And I'm really glad that we have these opportunities to actually think through these issues, David. Thanks very much.
Thank you very much. I think from the discussion, the very rich discussion today, it is very clear that the Commonwealth and its plurality brings a host of challenges, especially when dealing with an issue like a COVID or coronavirus pandemic in today's age, given the other development challenges we're faced with. But what has also been very clear is that Commonwealth countries, Commonwealth cities, Delhi, London, Ogun State, have been at the very forefront of trying to respond in the ways that are innovative, that are very creative. A few have been ahead of the curve. Others have been constrained by other types of challenges, investments, the ability for local and national governments and communities to work together. At the end of the day, if we're to overcome any of the challenges, if we're to be able to build resilient transnational and municipal transportation systems, it's going to be absolutely necessary to learn from best practices, to learn from others, to share experiences, and to exploit the network that is the Commonwealth in order for us to move forward. Over the course of the next year and a half, the Ramphal Institute will be offering other events, a third remote roundtable before the end of this year, and then into the first quarter of next year, a second international symposium that we will very likely engage other partners, Clean Air Asia, the National Institute for Urban Affairs in Delhi, the Commonwealth Local Government Forum, the Commonwealth Parliamentary Association, and others. That's important for us. We are a part of a bigger family, and we want to remain a part of that. And I think I have learned immensely from our panelists today, and I want to take this opportunity in closing to thank Professor Jagan Shah, the Senior Infrastructure Advisor at DFID, Mr. Elliot Treharne, who left us a bit early. He had to attend another meeting, and then Mr. Gbenga, Dairo, Commissioner for Transport in Ogun State, the first commissioner of his nature. So thank you all, gentlemen, very much for sharing your experiences, your ideas, your thoughts with us today. And thank all of the participants for joining with us on this remote roundtable and for being a part of the Ramphal experience. Have a nice evening, and I hope some of you have the sunshine that we're now enjoying in London, and that you have a good afternoon. Thank you very much.
Thank you, David. Bye-bye.
Bye-bye.
Goodbye, David. Bye-bye.
Bye, Gbenga.